Welcome back. Today we're talking about OCD, or Obsessive Compulsive Disorder. Now, Obsessive Compulsive Disorder is a mental health disorder, and just like many, if not all mental health disorders, it gets a bad rap. There's a lot of stigma and a lot of myth and a lot of confusion around what OCD is. So today I'm going to try and clear that up for you a little bit. I did my best to get my sources and information from scholarly and peer-reviewed articles. Without further ado, let's get into it. What is obsessive compulsive disorder? It's pretty simple when you break it down. Obsessions and compulsions. Those are the most important things in obsessive compulsive disorder. That's why it's named after it, after all. So what are obsessions? Obsessions aren't like just the kind of things that we obsess over. It's not like I'm obsessed with this, I almost said this politician. No one's obsessed with politicians unless they're talking about how much they hate them or dislike them. Obsessions are not just a typical, I'm obsessed with this show or I'm obsessed with this food. Obsessions, when talking about OCD, are more like thoughts, images, urges, almost a feeling of a premonition, even something that you are afraid is going to happen. These obsessions, I can't emphasize this enough. These obsessions are things that people with OCD do not want. They don't want to be struggling with it. They don't want these urges, which gets us into myth number one, which is that people with OCD are often violent or sexual deviants or just some sort of thing that they're not. People can be afraid of people with OCD, but that's wrong. People with OCD do not want these different obsessions. Which brings us to, so we just talked about obsessions. What comes next? That's right, class, compulsions. All right, so what are compulsions? Compulsions are repetitive behaviors or mental acts. So these can be something that you can notice, observe, or they can be things that are going on in a person with OCD's head. So compulsions are mental acts or physical acts that are often repetitive that people with OCD will do to help relieve the pressure or avoid thinking about that obsession. Because remember, obsessions are things that people with OCD do not want. When someone with OCD is having an obsession, then they will do a compulsion to relieve the anxiety or distress that's being caused by the obsession. Okay, is that making sense? We keeping up? All right, let's talk about 4 common categories of obsessions and compulsions. Now, these 4 doesn't mean that everyone with OCD has these 4 obsessions or compulsions. It just means that they're common categories that many people experiencing OCD, they'll have. So, number 1, not because it's the most common, but just in order of just simplicity, is cleanliness. If a person has an obsession of being afraid of germs or contamination, then they may have a compulsion to keep things clean and tidy and neat. Now, don't get that confused with the compulsion of symmetry. Symmetry is the second common category for compulsions, which is trying to keep things symmetrical. And this can be a mental kind of symmetry, whether it's thinking about something a certain number of times or drinking water a certain number of times, chewing a certain number, checking the stove a certain number. Whatever it is, it's a certain repetitive number that helps the person with OCD be able to reduce their anxiety because they've done whatever compulsion it is in that number, which helps them feel less stressed. Number 3 is when a person with OCD has a obsession, and again, this means that the person does not want these thoughts. It's not like they enjoy these thoughts. In fact, it's the opposite. So number 3 is when someone has forbidden or taboo thoughts or urges. These are often either aggressive, sexual, or sometimes they can be religious. These thoughts cause the person great distress because they don't want them, whether it's the fear or the obsession of having sex with this person or acting out aggressively towards this person or whatever it may be. It's an obsession with this thought that won't go away. They try to make it go away by doing compulsions, whether it's keeping things clean, whether it's keeping themselves busy, whether it's keeping things symmetrical, anything like that. And number 4 is harm. People with OCD sometimes will have an obsession to harm themselves or others. And again, this is a recurring thought a thought that they will harm themselves or others. Not that they want to do it, but just that it's a thought of like, I could do it, and what if I did it, and if I don't do blank, then I will be harmed or someone else will be harmed. Those are the 4 categories. All that to say that obsessions are thoughts that keep on coming back to us, that we try to push away and push away and push away, but they keep on coming back. And so someone with OCD does some compulsions to push those thoughts out. So what do you do if you think that you or someone you know has OCD? Well, the best answer is go out and see if you can find a therapist or a psychologist or a psychiatrist, someone who can help you get an assessment done. There's different ways that the assessment is done. One of the most common is called the YBOC, which is the Yale-Brown Obsessive Compulsive Scale. It's typically just about 10 questions that just talk about the symptoms you're experiencing. There are other ways to diagnose and test for OCD, but this is one of the more common ones. All right, so what does treatment look like? Well, treatment looks different for everybody, but one of the most common is to receive cognitive behavioral therapy, or CBT. Typically, when someone is receiving CBT treatment for OCD, then they'll receive exposure response prevention treatment, or ERP. I know, a lot of acronyms. ERP is essentially recognizing the exposure, which is the feeling of that obsession. And then the desire to do the compulsion is the response. So the exposure is you feel that obsession coming on. The response is the compulsion to make the obsession go away. And then prevention, pretty obvious. You do what you can to avoid or prevent doing the response or the compulsion. It's not as easy as it sounds. And people with OCD describe this as very psychologically, emotionally, and sometimes even physically distressing and hard. So don't just think it's just a super easy thing, but it is something that's super beneficial. It's extremely helpful for a person suffering with OCD and those around them. Someone with OCD can also receive medication, whether this is through a psychiatrist, preferably, or a trained doctor, or in some states, a psychologist. This is important to keep in mind because some people, it will really just help them along the process. The common medicine is selective serotonin reuptake inhibitors, or another acronym, SSRIs. Just to recap, if you or someone you know is experiencing or struggling with OCD, or you believe they are, or you are yourself, it's important to seek the help that you deserve and need to help you deal with some of these symptoms that you may be experiencing. I don't know you, and I'm not offering you medical advice. This is for educational purposes only. But I hope that this has been helpful for you, and if it was, then please check out this video or that video. Please like, maybe subscribe, and comment below if you yourself or someone you know has OCD and has similar compulsions or obsessions, if you feel comfortable talking about that. I'm always interested in learning. And again, consider subscribing.